Europe's top health officials have backed the AstraZeneca COVID vaccine, insisting the jab is safe, despite a growing list of countries hitting pause on the rollout over blood clot concerns. CSIRO Health Director Dr Rob Grenfell joins us now from Victoria. Good morning to you, Doctor. Thank you for your time this morning. You just heard Bill Botel talking about this. Do you agree that the rollout is far too slow?
Good morning, Karl. Look, it's a real honour to actually follow Bill to be interviewed, because Bill certainly is an absolute expert in regards to managing chronic diseases and infectious diseases in this country. So he's made some very, very relevant points about the precarious situation this country is in as we've achieved an amazing level of control of the virus in this country, but the threat exists, and the threat exists even at our closest neighbour, Papua New Guinea.
Because it has, there's been delays, it has allowed uncertainty to creep in. This is raising big concerns among Australians. An exclusive Today Show poll revealed 5.4 thousand won't be getting the jab, with only 2.2 thousand, that's 2,200, saying they would. Now, how are you going to reassure Australians that it's okay?
Yeah, look, risk to medications is, in fact, actually an occurrence with all of the common therapeutics that we actually take. And we do entrust our regulator, the TGA, to monitor and make sure that any medications that are available to the market are within safety margins, and so risk is much, much less than benefit. And that's what the European regulator came out saying last night, that the benefits of the AstraZeneca vaccine far outweigh any perceived risks, and the risks themselves with these current side effects will still need to be confirmed, and that's what they're investigating. So let's think about the actual risk we've got, and you've just heard Bill talking about the threats of new variants and others coming to this country. We are really only the next leak from our quarantine facilities and an out-of-control pandemic across the country. We know from many contracted cases worldwide, this disease is very dangerous. The CDC has given it around about a 2% fatality rate, but also given us a spread across various ages. So if you're in the over the 30 bracket, it's about a 1 in 900 chance of dying from it if you catch it. If you're over 75, it's a 1 in 9 chance of dying if you catch it. This is what we're looking at. We've got a closed country. So there are a number of reasons why we need to actually look at an expedited vaccine program. On the other side, what are some of those perceived risks? All of the adverse events that are occurring at a very low rate. Think there's 17 million doses have been given in the UK, and they haven't seen any of these adverse events. But what they have seen is a 94% decrease in hospitalisation from COVID. So, Karl, we have to look at the broader picture about what risks are, and also remembering that the TGA is there and doing a solid job in protecting us and balancing those risks for us.
So are you saying this morning that if you get a vaccine, then you won't get a variant?
No, what we've been certainly following those variants in our laboratory in some of our studies and looking at whether or not the current targeting will work. And also that's being tested out in the field where those variants are appearing, and looking at the effectiveness of the vaccine by other research agencies. So at this stage, we're very confident that the current variants are covered by the current vaccines. However, into the future, we will require Generation 2 vaccines, and I'm pleased to say that they are in development now.
Matt Canavan said, let's pause it. What do you say?
Again, a little perplexed by the pausing of this. The European countries have paused it. Now, their regulators said they should continue doing it, and in fact they're investigating those risks. And the WHO has said that the vaccine is very effective, and the safety margin at least is far greater than actually being stated by those countries.
Good to talk to you, Rob. Thanks for your time today. Appreciate it.
No trouble, Karl.